Hello everyone, welcome back to my channel. Today we will be discussing on the remaining portion, like from the beginning of the autopsy. So, in autopsy, the main important topics are question-wise related, like types of incisions. Types of incisions, you can find different types of incisions like I shape, Y shape, well, I shape, Y shape. I shape, Y shape, modified Y shape. Okay. And what is the procedure of performing the autopsy? So we have different procedures like Rokitansky procedure. Rokitansky is like Rokitansky is like in situ incision. Lettuce is en mass. Gons is en bloc, GB. And Richards is one by one organ removal for autopsy. Okay, fine. So we have different types. Now, remaining part, now let's discuss. So these things were discussed previously.
Now let's move on to the further. Yep. Forensic medicine and toxicology is an important question. In the previous years, shift 1 and 2, many questions were asked from this topic. So the influence is increasing. Pattern is something. The pattern has changed and also the preference has changed. Community medicine, pathology, holistic medicine, surgery. From all these topics now important questions are asked. Yeah, let's move on to the topic. We'll do drowning, mechanical injuries. Sorry for the background disturbances, guys. Especially with stupid people, they make a lot of noise. Sorry for the inconvenience. But now let's continue. So we have autopsy. We discuss about autopsy, mechanical asphyxia, and drowning, mechanical injuries. So these are the topics we'll be discussing. So now let's begin with drowning. We will also deal with thermal deaths and all. Mechanical asphyxia is important. Okay. So now let's start with mechanical asphyxia. What is the definition of a mechanical asphyxia? Mechanical asphyxia is definition is lack of oxygen, excess of carbon dioxide in tissues due to interruption of breathing or inadequate oxygen supply because of interruption or maybe inadequate oxygen supply like in case of asphyxia due to carbon monoxide poisoning. Carbon monoxide poisoning, there is an inadequate oxygen supply. 1 minute, there's a lot of disturbance. These kids are very stubborn. They are not leaving from here. I have been scolding them to just leave and get out, but they're not all listening, making noises. They can't play silently, shouting like instead of lying. They have mic. Okay, fine. What is artifact? What are artifacts? Last time we missed this topic, so let's do it. Postmortem artifact. Artifact means anything which is not real. Like postmortem artifact, it is a change or feature which was not present in the body before death, but it has occurred after death. The class starts after 10 minutes, guys. Yeah, after 10 minutes class is starting. So now we are discussing about postmortem artifact. What is the meaning of artifact? Artifact is something which is not real. And postmortem artifact means it is a change or feature which was not present in the body before death, but it has occurred after death. It leads to misinterpretation of medico-legally important findings. Okay. Artifacts may be introduced during treatment of the patient or before autopsy or during autopsy. Types to remember artifacts is agonal, resuscitation artifacts, rigor mortis, refrigeration, lividity, decomposition, toxicological, embalming, fractures, animals and insects. Chemical, gasoline looks like thermal burns. Thermal burns. So artifact is something which is not real. So postmortem artifact is it was not present in the body before death, but it has occurred after death. So sometimes it leads to misinterpretation. So types of artifacts is agonal. Agonal artifact is, so you have agonal, resuscitation, rigor mortis, toxicology, embalming, fractures, animal and insect, chemical and thermal. Almost 9 artifacts you can see. So agonal means introduced just before birth, like regurgitation and aspiration gastric fluids into respiratory tract. Esophagogastromalacia. Cl and pepsinogen released from gastric mucosa causes softening and auto-digestion of stomach and esophagus. So agonal is introduced before death. Okay, regurgitation and aspiration of gastric fluids into the respiratory tract. So esophagogastromalacia is Cl and pepsinogen released from gastric mucosa. It causes softening and auto-digestion of stomach and esophagus. Next is resuscitation artifacts. Changes or injuries that occur due to cardiopulmonary resuscitation. What is the meaning of cardiopulmonary resuscitation? Changes which occurs due to cardiopulmonary resuscitation. Injuries to the bone, like while giving the CPR, there is a rib and sternal fractures. It is mistaken for mechanical injury. Soft tissue injuries like bruising of the anterior chest wall mistaken for physical assault. Bruising of anterior chest wall because it is a soft tissue, right? Some bruising is there, it is mistaken for physical assault. Internal organ injuries, lacerations of liver, spleen or heart mistaken for blunt force trauma. Injuries to respiratory system, tracheostomy wound may appear as stab wound, aspiration of vomitus leading to pulmonary edema. Okay. Injuries to GIT, rupture due to excessive ventilation mistaken for pre-existing pathology. Particular measures can occur due to prolonged chest compression mistaken with asphyxial death. Defibrillated burns. Electrical burns or the chest due to defibrillation attempts mistaken for electrical thermal burns. Circular marks over the chest due to the use of defibrillator. While resuscitating the patient, getting back the BP, heartbeat and breathing, defibrillators are used to get back the heartbeat. So that can be mistaken for the burns. Electrical thermal circular marks can be seen over the chest. Particular hemorrhages can occur due to prolonged chest compression mistaken with asphyxial death. Injuries to GID. Gastric rupture due to excessive ventilation mistaken for pre-existing pathology. Gastric rupture due to excessive ventilation mistaken for pre-existing pathology. Injuries to respiratory system tracheostomy wound may appear as stab wound. Tissue and vomitus linked to pulmonary edema. IV and IO access related injuries, bruising, needle marks or extravasation, IV site mistaken for drug abuse or medical negligence. Needle marks. Medical legal importance is correlation with clinical records, witness statements, and forensic expertise is necessary. A thorough case history and investigation of resuscitation efforts are important. Differentiation between antemortem postmortem injuries is important. Medical microscopic examination presence of vital reaction indicates antemortem injuries. Artifact related to rigor mortis. Breakdown of rigor mortis due to rough handling of the body during transportation of the body. Rigor mortis of involuntary muscle may result in apparent growth of beard, discharge of semen from penis, and unequal size of pupils. Okay, artifacts related to lividity. Lividity in the intestine appears as infarction, lividity in the heart appears as myocardial infarction, lividity in the lungs appears as pneumonia, lividity in the brain appears as hemorrhage. Banding. Areas of pale bands, VBCs, alternating with hypostatic area is seen in esophagus. These pale bands are due to pressure by trachea. Similarly, pale bands, VBCs in the skin of neck appears as ligature mark of strangulation. The embalming artifacts. Changes or alterations that occur in the dead body due to embalming process which might be mistaken for injuries or pathological findings during an autopsy. Changes or alterations that occur in the body due to embalming process. What is embalming process? It is an embalming process. The natural fluid of the body is removed and other chemical fluid is injected to preserve the body. These artifacts must be differentiated from two antemortem injuries or pathological findings during forensic investigation. Common embalming and tissue fixation and hardening. Blood displacement, color changes, skin slippage, dehydration, shrinkage, gas formation, injection marks and cannula sites, purge fluid from nose and mouth, visceral changes. Toxicological artifacts, contamination of viscera with stomach contents give false results. Faulty technique collecting sample gives false result. Blood from human bodies contain methanol gives false values of alcohol. Decomposition increases concentration of carbon monoxide and cyanide. Embalmed bodies, it is difficult to extract poison for the analysis. Buried bodies, arsenic may be imbibed from the earth. Animal and insects and ant bites over moist areas resemble abrasion. Rodents gnaw away tissue and shallow craters are formed. Dog bite may resemble stamp wound. Larger animal may mutilate the body. Artifacts due to decomposition. The body becomes black and bloated due to gas formation. Thus identification becomes difficult. Blister formation, splits in the skin, separation and sculptures, holes created by maggots resemble gunshot wounds. Dimensions of antemortem wounds are increased. False ligature mark around neck is formed due to tight collar. Dilation of vaginal anal canal postmortem purge, blood stain from exudes mouth and nose. Blood stain from the mouth may lead to wrong diagnosis of death due to drowning. Blood stain froth at the mouth may lead to wrong diagnosis of death due to drowning. See, skin slippage is common embalming artifacts, tissue fixation, hardening. Formaldehyde and other chemicals cross-link proteins leading to rigid tissues. It becomes difficult to assess the rigor mortis. Blood displacement, chemical injection alters blood distribution, tissue perfusion, displaces thrombus and bullae. Color changes, grayish means the skin due to formaldehyde reacting with hemoglobin. Pink means mistaken for liver motives due to carbon monoxide poisoning. Pink on it. Bleached areas, some regions appear pale due to formalin diffusion. So this gas formation can also be pseudoemphysema. Improper embalming or bacterial action can lead to gas production in tissues, mistaken for subcutaneous emphysema. Injection marks in cannula sites embalming fluids are introduced via cannula in the carotid of femoral artery. Needle marks mistaken for drug abuse or use or medical procedure. Incisions of a cannula mimic sharp force injuries. Irrigation and embalming sites, bloodstream leakage which interpreted as hemorrhage. The idea you can see how Dr. Saruke and Dr. Tarika. No, she's not doctor. She's not Dr. Tarika, I think. They investigate the things. Now coming to mechanical asphyxia. In asphyxia, we'll see the definition types, introduction. Okay, then we go for so embalming. Embalming artifacts is of different types like skin slippage, tissue discoloration. Okay, so artifact is something which is not real. So artifacts are something which were not present before death, but they develop after death, and they are mistaken for something else. Okay, color changes, skin slippage, dehydration, hardening, rigor mortis, injection marks in cannula sites, purge fluid from nose and mouth, visceral changes. These are there. So we have artifacts different types. So you can remember by the trick artifact itself. A, agonal, R, resuscitation artifacts. One more are rigor mortis, refrigeration, lividity, decomposition. Then T for toxicology, for embalming, F for fractures, A for animal and insect bites. Okay. Then chemicals, the last thermal ones. Okay. So these are the things. So like maggots bites resemble the holes created by the maggots resemble the gunshot wounds. These are artifacts. These are actually not present before death of the person, but after death due to decomposition, all these happens. Okay, animal and insects. So you should be able to differentiate it and not mistake for it. Okay. Contamination of viscera with stomach contains the false results and the toxicology. Okay, carbon monoxide and cyanide concentration are increased due to decomposition. So I was planning something for this week and weekend. So daily we'll have at least one live session, either from forensic or community medicine, or maybe some subjects like the medicine, surgery, psychiatry, dermatology, ops, gynae, pediatrics. Daily, at least one session will be there. So it will be very helpful. 1 hour or maybe depending upon the topic. Okay, so today we have to complete the mechanical asphyxia part, and already we have discussed autopsy. Autopsy, the incisions, types of incisions like I incision, Y, modified Y, back X excision. So these are important. Other than that, the method of performing the autopsy, like Virchow's method, it is one by one organ removal. Rokitansky is in situ autopsy. It is done in highly infectious patients like HIV. Other is Gaunt's method. It is en bloc method, GB. En bloc method. Gaunt's method is en bloc. And then lastly we have another, that is Lecque's method. It uses continuation of the organ is present. So it is from the tongue to the prostate. As it is, the organs are removed. The continuation is present. Okay. En masse. It is en masse. Okay. So These are the methods. Then we have artifacts. Then we have individual dissection of the organs. Okay. So negative obscure autopsy. These types of autopsy, we have negative autopsy where all investigations are done but still we cannot find the cause of the death. So that is called negative autopsy. Obscure autopsy is done meticulously and perfectly but no clear cut findings are seen give a definite cause of death. Negative autopsy means cause of death cannot be established after gross examination, toxicology, pathology, histology examination. No cause is found. Then negative. Obscure means autopsy done meticulously, perfectly, but no clear-cut findings give a definite cause of death. It leads to confusion of the forensic pathologist. Autopsies, especially in neonates and infants, fail to provide satisfactory morphological lesions, mortuary or laboratory. Adequate history is present, but clear-cut cause is not known. It is obscure. Virtual autopsy, it is not done in India, but here in this CT scans, MRI scans, and computer 2D imaging, 3D imaging is done to find the cause of death. Endoscopic autopsy is camera is fitted, external auditory matters, mouth cavity, larynx, etc. examined directly. Okay. Then other than that, we have psychological autopsy. Psychological autopsy where the nothing is done to the body, but the mood and behavior of the victim is tested by questions with the families and friends of the individual. That is psychological autopsy. Then other than that, we have pathological autopsy. Pathological autopsy is actually here in this pathological autopsy, the cause of death is known. Suppose myocardial infarction, but the tissues are extracted to see that area of the infarct and study that. Okay, study purpose. Medical legal autopsy. This is most common. It is done to find the cause of death in suspicious deaths. Okay, in unnatural or suspicious death. Okay, so this is the medical legal autopsy. So it is most common here. Consent of the relatives and the friends, family is not required. Another topic in autopsy is exhumation. Exhumation is digging out of an already buried body for the medical legal examination. So there is no time limit for exhumation. Reasons for exhumation is to determine the cause and manner of death, to collect more evidence and more information and identification in case of inheritance, insurance claims, etc. And this exhumation can be done only by the return orders from the executive magistrate. The executive magistrate return order only authorization is given for the exhumation of the body. Okay. Next of kin relatives must give consent except in criminal cases. Procedure, death certificate, burial permits, etc. are reviewed. Okay. If necessary, first autopsy, second autopsy is done to collect more information. Ethical and religious issues is the challenge. Already buried body should not be removed. Further ethical issues will be there. Body will be decomposed. Difficult to find exact cause. Contamination by water and soil. Okay, crime scene reconstruction is another term. One must be aware of the specific terminologies associated with the skills, knowledge needed for crime scene reconstruction. Now I have to analyze, deduction, induction, typology. Analysis starts with analysis the whole crime scene and then breaking it down into individual units. Deduction explores logical sequences of events, like you have seen in the movies when the detective or the forensic doctor or pathologist comes to the scene of crime. Every the show, all the scenes will be repeated. So in a sequential manner. Induction, skills, experience, scientific test, and computer reconstruction animation applied to a crime scene to come to a conclusion or hypothesis. Typology, sorting out facts into specific categories of knowledge. Now, let's move on to mechanical asphyxia. I have some water and then we'll deal with it. Mechanical asphyxia. Lack of oxygen, excess of carbon dioxide in tissue. due to interruption of breathing or inadequate oxygen supply. I have sore throat. Again, something wrong with my throat. Today, I was being very restless, very much restless. Now it's okay. I didn't come at the live session, but tomorrow onwards we'll continuously have live sessions. Forensic, community medicine, with subjects like anatomy, physio, biochem, patho, pharma, healthcare. But mostly patients will be accepting community medicine, like general internal medicine, general surgery, pediatrics, as well as dermatology, psychiatry. Psychiatry, we dealt with the history technique. Okay. Now let's see the type. See, in the Greek, asphyxia means stopping of pulse. So some pathology in the respiratory tract or lungs, just pneumonia, atelectasis, lung abscess, laryngeal spasm. These are the pathological asphyxia. Some poisons such as carbon monoxide, cyanide. Opium barbiturate, strychnine, toxic asphyxia. Mechanical obstruction in the respiratory tract or lungs, mechanical asphyxia. Types of mechanical asphyxia: hanging. When the person is hanged, the larynx, the neck structures, jugular vein, carotid artery, they are constricted. Strangulation, same mechanism. Suffocation, the breathing is halted, okay. Gagging, something is, inserted into the mouth, so the person cannot breathe. Choking, something is obstructed into the pharynx, larynx, okay. Traumatic asphyxia, working, overlaying, drowning. So see in general and end of the session. Classical signs: cyanosis, congestion, petechial hemorrhages, pulmonary edema. Right side of the heart is filled with blood and copper. So cyanosis will be there, bluish discoloration because of lack of oxygen, congestion because of obstruction, right? Petechial hemorrhages because of small arteries get blocked. Petechial hemorrhage and like rupture. Petechial hemorrhages, pulmonary edema, fluid in the lungs, so person cannot breathe, oxygen cannot reach to the body. Right side of the heart is filled with blood, cor permanent. The blood cannot reach the lungs. Okay. Dark fluid blood due to fibrinolysis. Hanging and strangulation asphyxia caused by suspension of the body by a ligature which encircles the neck. Weight of the body acts as a constricting force. So we have typical hanging. Knot is at the occiput, at the back of the neck, occiput. Atypical hanging knot is not at the occiput. Complete hanging, body is completely suspended in air, feet does not touch the ground. Partial hanging, some part of the body touches the ground. Person may be kneeling, sitting, or lying down. Causes of death in hanging: immediate asphyxia is caused by compression of trachea. So 15 kg of weight is just required to compress the trachea. Venous congestion caused by compression of jugular vein. 2 kg weight is required for compression of jugular vein. Just 2 kgs, imagine. Combined 1 and 2. Cerebral anoxia, it is caused by compression of carotid artery. 4 kg of weight is required for the compression of carotid artery, just 4 kg. So least is for jugular vein because it's superficial, 2 kg. Carotid double and 4 kg. And 15 kg for the compression of trachea. Reflex vagal inhibition is caused by compression of vagus nerve. Vagus nerve is compressed. Reflex vagal inhibition. Delayed aspiration, pneumonia, infections, infection of brain tissue, hypoxic encephalopathy, external causes and internal causes. to the ligature marks. Ligature marks can be seen naked eye appearance, level of ligature mark. So sympathetic overactivity, neck congestion. So Lee facies sympathetic. What is it? It is the facial expression seen in case of hanging where the victim eyes open with a frightened expression of face. Seen in cases of hanging where the victim's eye open. Okay? Because of sympathetic overactivity, not present the cervical sympathetic ganglia, pupil dilation, expression of fear of or surprise. Medical legal is if present indicates the person was alive at the time of hanging. So low facies sympathetic is because of sympathetic overactivity, and here the patient was alive when he was getting to hang. So the patient was unconscious and then the patient was hanged to stimulate the suicide case. Okay? So low facies sympathetic. Obstruction of venous return from the heart. Patient engorgement, cyanosis of particular hemorrhages exaggerating the startled look. Asphyxia and anorexia can trigger inverting muscles when contributing to the expression of fear. Increased pressure in the head, protrusion of the eyeballs, and of conjunctival hemorrhages. So here fracture of hyoid bone is seen. Hyoid bone usually ossifies after 40 years. After 40 years, complete ossification takes place. Okay, greater cornu fracture will be the most common. Body fracture is less common. Bilateral fracture. Next is lynching. What is lynching? Homicidal hanging. Lynching is homicidal hanging. If you're hanging the person, it is lynching. Or enemy. See, Captain William Lynch of the USA used to order hanging without trial. Accused or enemy is hanged by a rope from a tree by a mob. Hanging after death of the person to conceal murder and create a scene of suicide. So, conceal murder. Judicial hanging. In India, capital punishment is carried out by judicial hanging. Okay. But in India, the case is different. Here, the criminal is covered on the face and made to stand on trap doors. Okay, they are open downwards. Okay, a rope 5 meters is looped around the neck, not under the angle of jaw. Okay, angle of jaw not is front. A bolt is pulled, trap door opens, the person droops downward up to 5 to 7 centimeters. Sudden stoppage of the moving body causes dislocation, fracture of atlanto-occipital joint. C2, C3 and C4 vertebra are fractured. So upper cervical cord is torn or stretched and brainstem also gets injured. So immediate unconsciousness and death due to damage of vital organs. So here sudden water the slant will be there 5 to 7 meters the person will fall. Sudden because of the rope because it is only 5 meters now it will stop because of that dislocation of atlanto-occipital joint. Heartbeat, respiratory movements and spasmodic muscular jerking continue for a few minutes. Asphyxial signs are not seen. Strangulation is constriction of neck by a ligature without suspending the body. Other is mugging. What is mugging? Bend of the elbow is used for strangulation. Strangulate the victim, resulting in asphyxia and death. So someone from behind will hold with the help of the arm and with the help of the elbow trying to constrict the trachea and asphyxia as well. What is Banstola? One or sometimes two bamboos are placed across the neck or sometimes chest and back. Pressure is applied, ends are tied to a rope or a saline stand on the neck. Asphyxia, coma and death. Spanish windlass iron collar is tightened by screws. Victim dies due to asphyxia. You might have seen in older Spanish movies how that is announced. Iron will be there. The head is kept between that. It is the circle, and then the screws are tightened, and the person died because of asphyxia. Garroting. Garroting is ligature, chain, rope, scarf, wire, etc. is thrown over the neck from behind and quickly tightened. The victim becomes unconscious and collapses. Manual garroting. A simple cord or wire tightened by hand. Similar to strangulation. See, luggage thrown over the neck and then tightened, and the person collapses. Garroting. Then we have throttling. Asphyxia caused by compression of the neck by human hand. Cause of death same as strangulation. Same. Throttling is compressing with the hand. So ligature marks is not there, but hand finger marks are there. Okay, suffocation. And what is suffocation? Lack of oxygen, because lime kilns, sewers, unused wells. Death is due to asphyxia. Failure of aircraft cabin. That time also. Smothering. Smothering is asphyxia caused by the closure of mouth and nostrils by hand. Other means such as towel, pillow. Closure of mouth, nostrils by hands or towel, pillow causes asphyxia and death. Okay. So smothering is something kept in front of the nose and mouth tightly, not able to breathe. Asphyxia caused by blocking of the pharynx. Asphyxia caused by blocking of the pharynx. A gag such as cloth paper is pushed deep into the mouth. Gag is pushed deep into the mouth and then the pharynx. Blockage of air, asphyxia and death. Choking, obstruction within the air passage, throat, larynx. Gagging is up to pharynx. Next is burking. What is burking, guys? Smothering plus traumatic asphyxia, Parma strangulation. William Burke and William Hardy, residents of Scotland, Edinburgh, invite guests and intoxicate with them with the alcohol. Burke sits on the chest and closes the mouth and nostrils with pressure. Hair drags the victim all around the room, pulling his or her feet. Victim dies because of accident. The dead body was supplied to Dr. Robert Knox, Professor Anatomy, Edinburgh Medical College. The kids 16 persons like this. So to supply the body for the anatomy professor in Scotland. Very dangerous. Working is smothering. Smothering is closure of mouth and nostrils. The asphyxia. Plus intoxicating them or strangulating them. Parma strangulation. Cafe syndrome. Accidental choking in a restaurant. A person intoxicated with alcohol is eating food in the restaurant. Bolus of food enters into larynx. Cough reflex is because of intoxication. Choking first. Death is due to reflex vagal inhibition. Both death occurs immediately. It was thought that death is due to heart failure. A blow on the back or sternum. Because the person is intoxicated, something goes into his mouth and suddenly falls. Because of choking, he cannot breathe. Overlaying, it is an accidental asphyxia in infants. When I was sleeping, a child or another child rolls over them during sleep, causing suffocation and death. So that's why different bed for the child. So this is sudden infant death syndrome. Traumatic asphyxia occurs by mechanical fixation of the chest so that movement of chest wall are prevented. This is lower laying is very dangerous. That's why separate bed for the children, for the small child, baby child. Okay, asphyxia caused by mechanical fixation of the chest. Okay, so that the movement of chest are prevented. Positional asphyxia due to abnormal posture of the individual.